So, good evening, everyone. My name is Dr. Govind Kasat. I am MD Medicine, DM Nephrology, and I would like to welcome you all for this session. And we will be discussing on generalized edema and pedal edema. So, pedal edema is a clinical condition uh, in which the body accumulates excess amount of water, which normally is excreted by the kidney, but due to a few reasons like acute kidney injury or chronic kidney disease, the kidney is not able to excrete that amount of water. So there is water logging, which results in excessive amount of water in the body, and which is experienced by the patient as swelling over both the lower limbs, which is clinically called as pedal edema. So pedal edema is basically excess amount of water and salt, which usually is excreted by the kidney. But in conditions when there is a defect in the renal function because of the disease process, this excess amount of water and salt is logged in the body, and that is represented as pedal edema. So there are various reasons for pedal edema. A few of the reasons are like chronic kidney diseases or anything that involves kidney conditions. Then there are cardiac conditions like congestive cardiac failure. Then there are conditions associated with liver, like liver cirrhosis, and localized conditions like cellulitis, which represents or which presents as pedal edema. So we will be discussing more about kidney conditions. So any disease in which there is affect or there is affection of the renal function that results into pedal edema. Uh, Generally, patients with diabetes mellitus or patients with hypertension or patients with renal calculi disease, they lands up in volume overload, and this is leads to accumulation of excess amount of water either in the leg regions or in the pleural cavities or in the third space, resulting into a generalized anosmia. So patient may complain of having swelling in the lower limb or difficulty in breathing, or he may complain about exertional dyspnea or decreased amount of urine output. So such cases we deal with diuretics. Diuretics, these are the major source or the primary weapon we use for treating these conditions whenever there is pedal edema. So there are various types of diuretics like loop diuretics, thiazide diuretics, and potassium sparing diuretics. The most commonly used is loop diuretics, and the best among loop diuretics is torsemide. So it acts on the ascending loop of Henle in the kidney, which results in inhibition of a receptor, which causes reabsorption of the sodium chloride and potassium channel. That results into excess amount of urination. There is free water loss as well as there is loss of sodium and chloride. This results in excess urine formation or increased urine formation, and uh, that results into decreased amount of swelling over the lips. Now, there are other conditions that are also associated with chronic kidney disease and generalized. When there is a pleural effusion, pleural effusions means there is accumulation of the water inside the pleural cavities, and there is accumulation of excess amount of water in third space like ascites or pericardial effusion. So we use diuretics to treat such conditions, in which torsemide is like a primary weapon which we use for treatment of such volume excess condition. There are other diuretics also like thiazide diuretics, but clinically we find thiazide diuretics as less potent. These are diuretics, but the amount of free water excess, free water loss that occurs with thiazide diuresis is much less as compared to the loop diuretics. And third types of diuretics are like potassium sparing diuretics. Whenever we use diuretics, there is loss of potassium, salt, and sodium and chloride in the urine that results into hypokalemia. So potassium sparing diuretics are a special class of agents which causes loss of sodium, but there is some amount of compensatory mechanism which results in less amount of loss of potassium. So potassium sparing diuretics we use in very limited number of patients whenever we are having a view that use of diuretics, thiazide or loop diuretics will result into hypokalemia. So in such cases, we use potassium sparing diuretics. So if you can ask me questions, I can answer those questions.